Ru-Hist D is a combination medication used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses, such as sinusitis and bronchitis. It helps relieve watery eyes, itchy eyes/nose/throat, runny nose, sneezing, stuffy nose, and ear congestion symptoms. If you are self-treating with this medication, carefully read the package instructions to be sure it is right for you before you start using this product. Some products have similar brand names but different active ingredients with different uses, so it's important to ask your pharmacist if you have any questions about your product or its use. Cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. It's important to ask your doctor or pharmacist for more details about using the product safely. Ru-Hist D does not cure or shorten the length of the common cold, and may cause serious side effects, so it's important to carefully follow all dosage directions and not give other cough and cold medication that might contain the same or similar ingredients. It's best to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Ru-Hist D, it's important to follow the dosage instructions provided by your doctor or on the product package. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device and shake the bottle well before each use. It's also important not to crush or chew extended-release tablets or capsules, as this can increase the risk of side effects. If you're using chewable tablets, be sure to chew each one thoroughly before swallowing. And if you're using a product that dissolves in the mouth, be sure to handle it with dry hands and allow it to dissolve completely on the tongue before swallowing. The dosage of Ru-Hist D is based on the product you're taking, your age, medical condition, and how you respond to treatment. It's important not to increase your dose or take this medication more often than directed without your doctor's approval. If your doctor has instructed you to take Ru-Hist D daily, be sure to take it regularly at the same time each day to get the most benefit from it. And if your condition lasts for more than 1 week, gets worse, or occurs with a persistent headache, fever, or rash, be sure to contact your doctor as these may be symptoms of a serious medical problem. Some common side effects of Ru-Hist D include drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this product for you, it's because they believe the benefit to you outweighs the risk of side effects. Many people using this product do not experience serious side effects. Seek immediate medical attention if you experience any serious side effects, such as mental/mood changes, ringing in the ears, difficulty urinating, or vision changes. In rare cases, a very serious allergic reaction may occur. Get medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. Contact your doctor or pharmacist if you notice any other effects not listed here. For further medical advice about side effects, consult your doctor or pharmacist. In the U.S., you may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor or report side effects to Health Canada at 1-866-234-2345. It's important to talk to your doctor or pharmacist before taking Ru-Hist D if you have any allergies or medical conditions. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's best to avoid driving or using machinery until you know how this medication affects you. If you have diabetes, alcohol dependence, liver disease, or other conditions, make sure to ask your doctor or pharmacist about using this product safely. It's also important to inform your doctor about all the products you use before having surgery. This medication may have different effects on children and older adults, so it's important to be cautious. If you are pregnant or breastfeeding, make sure to discuss the risks and benefits of using this medication with your doctor. It's important to be aware of potential drug interactions when taking Ru-Hist D. This medication may interact with certain antihistamines applied to the skin, as well as MAO inhibitors, which can cause serious and possibly fatal interactions. It's crucial to avoid taking MAO inhibitors during treatment with Ru-Hist D, and to consult your doctor about when to start or stop taking this medication. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness, and consult your pharmacist about using those products safely. It's also important to note that Ru-Hist D may interfere with certain medical and lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Ru-Hist D and experiences severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include irregular heartbeat, hallucinations, fainting, and seizures. If your doctor has prescribed Ru-Hist D, it's important to follow their instructions and not share the medication with others. Make sure to keep all medical and lab appointments while taking Ru-Hist D to monitor your progress and any potential side effects. If you are taking Ru-Hist D on a regular schedule and happen to miss a dose, make sure to take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed one and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. As for the optimal timing, make sure to take Ru-Hist D as directed by your doctor and follow the dosage instructions carefully to get the most benefit from this medication. It is important to store Ru-Hist D at room temperature, away from light and moisture. Avoid storing it in the bathroom and do not freeze the liquid forms of this medication. Keep all medications out of reach of children and pets. When it comes to disposing of Ru-Hist D, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.